Good evening, everyone. Welcome to the Facebook Live from Raheja Hospital, SL Raheja Hospital. It's a real pleasure to be here today, and I'm pleased to introduce to our speaker, Dr. Jayesh Sardhara. He brings over 15 years of expertise in minimally invasive endoscopic cranial and spine surgeries to SL Raheja Hospital, a Fortis associate. Dr. Sardhara's distinguished career includes a professorship in the Department of Neurosurgery at SGPG Lucknow, where he gained extensive experience in advanced brain and spine surgeries. His specialized training spans globally renowned spine surgery centers in Japan and Seoul, South Korea, and includes an endoscopic skull based surgery course at AOTS, Tokyo, Japan. Additionally, Dr. Sardhara has trained in epilepsy surgery at the Sri Chitra Institute, Kerala, and is frequently recognized for his clinical and research contributions, including the Best Young Neurosurgeon India Award in 2016. He is known for keyhole brain and spine surgery and has performed more than 1,000 brain tumor surgeries on brain tumors in 15 years. So please welcome Dr. Jayesh Sardhara. Welcome, sir, to the live.
Thank you, Dr. Arjuman, and really pleased and glad to be here in this show.
Thank you, sir. Sir, we have a lot of questions for you.
Yes, please.
So let's start with as you have performed more than 1,000 on brain tumors in 15 years. So could you please tell us the incidence and the types of brain tumors that you have come across?
Yeah, so basically, brain tumors. There are two type of brain tumors. Brain tumors is which is the abnormal growth of the cells,
Okay, sir.
abnormal growth of the normal cells, and
Yes.
then it becomes abnormal cells of the brain. So brain tumors are of the two type, whether it is a benign and malignant. Benign means which will not grow rapidly. It is restricted to one part of the brain. It is curable after complete excision of the tumor. Malignant tumor is something which grow fastly, have a frequent recurrence with short survival period. The other types are primary. It means the tumor will arise from the one part of the only primary related to brain only, that is primary tumors. It is arise from brain. Whereas the tumors which is arise from other part of the body, like from breast or prostate, and then this tumor is shifted to the brain and it is detected as a secondary brain tumor. It's called metastatic brain tumors.
Okay.
Why it is important to understand this? Because now the incidence of brain tumor is also growing. As per International Cancer Registry, per day we detect 28,000 tumors per year. And in India, its incidence is almost 5 to 7 per 1 lakh Indian population. So this is all gross evidence. And pediatric brain tumors is more common. In
Oh,
fact, pediatric brain tumor is the second largest tumors can happen in the pediatric population. It's
okay.
the- So why it is important to detect benign and malignant? Because there are some myth also, which today this is the opportunity so that I can rectify that kind of myth in the society. All brain tumor is not the cancer. So no need to worry if you find that kind of word, oh, I have a brain tumor, or my relative has a brain tumor, SME.
Okay.
So only if brain tumor is benign, it is curable. And not all the brain tumor are cancers. Second
Oh,
thing, it is not possible that laptop ज़्यादा देखने से या मोबाइल से
जी.
ब्रेन ट्यूमर्स नहीं होते.
जी,
Brain
sir.
tumors usually happen by genetic mutation, some change in the chromosomes, genes, anomalous abnormality at the time of birth.
Um,
Sometimes it happen in family per family. That is only the 30% of case.
okay.
Sometimes, if you give a lot of radiation in the pediatric age group, then yes, there is a chances of brain tumor after 2 or 3 decades. That is quite possible. So
Okay.
this is the cross about the brain tumors.
So, sir, there's a difference between pediatric and adult brain tumors. Like, is there a specific part of the brain that is affected in pediatric and in adults? Could you
Yes,
please
yes. Very nice.
talk about it?
Very nice question. So, if we say benign tumor, most common benign tumor is meningiomas, which is arising from the outer layer of the brain called dura. So, वहाँ से जो tumors होते हैं meningiomas बोलते हैं. They are very common and it is a benign tumor and completely curable with very good prognosis. In adult, the most common malignant tumor we all heard is glioblastoma or GBM, glioblastoma multiforme, and which is a very common malignant brain tumor. And usually it happens in the outer surface of the brain. There are five brain structure like frontal lobe, parietal lobe, temporal lobe. तो उसमें ज़्यादा common होता है.
G.
Pediatric age group, ट्यूमर मोर कॉमनली अराइज फ्रॉम द पोस्टियर छोटे दिमाग में से सेरेबेलम में से अराइज होता है
Okay.
like medulloblastoma. The name of the common tumors are the medulloblastoma and appendymoma. So if you ask me the symptoms, कैसे पता चलता है कि brain tumors है, which is very very important to identify. So it is very very essential that if somebody have a headache for more than 6 month duration, continuous headache more than 6 months, at
Yes.
least any physician who contacted or consultant, at least patient should underwent a one plain CT scan of the brain.
Okay.
It is very important because what happened now, the migraine or stress headache is another common differential diagnosis. So
Yes.
लोग कंटिन्यूस पेशेंट जो है हमारे पास कई पेशेंट आते हैं जो है 4 साल से हेडेक हो रहा था nobody has suggested scan कर ले and then suddenly somebody have given an idea of a scan CT brain or MRI brain and then suddenly find out oh this is a large brain. Now the problem is that the size the tumor grow, the more the larger tumor,
G.
the surgery is very complex, the recovery is complex, and outcome is poor. So early you detect the brain stem. So how you can detect early? So the WHO said if somebody have at least more than 6 months to 1 year headache, at least go for the plain CT brain, just to rule out the brain stem. Now, so the first symptoms incidentally. Patient came present incidentally for another reason of headache or something. Second reason, weakness, which is very, very common. Third, weakness of the hand, weakness of the leg, paralysis. Usually it is slow growing, not like a stroke, जिसमें suddenly patient को paralysis होता है. धीरे धीरे होता है.
Okay.
If it is present in the posterior fossa, near brainstem like vestibular swan, sometimes hearing loss, sometimes imbalance, चलते चलते बैलेंस खत्म हो रहा है विजुअल डेफिसिट थोड़ा एक तरफ का कम दिखाई दे रहा है like pituitary adenoma, craniopharyngioma, this kind of tumor usually present with a vision loss, half cut of the vision, blurring of vision. With the
Yes.
seizure, बच्चों में ज़्यादा common symptoms है. Seizures means आज की आना epilepsy. So sometimes if you have a patient have a long time epilepsy, then at least you should go the CT scan brain or MRI to rule out the brain tumors also. Then in pediatric patient usually छोटे बच्चे less than 3 years old they cannot complain the headache. They usually present with vomiting, lack of milk drive. जब दूध पीते ही वॉमिट कर देना या
Yes.
इरिटेबिलिटी होना समटाइम्स फीवर आना so these are the symptomatology of the brain tumors how patient can do yeah one
Uh,
more important age which age it
yeah.
is common in
Uh,
pediatric the brain tumors is usually seen in 5 to 15 years of age and in
5 to 50.
adult which is more commonly seen in the third and fourth decade.
Third and fourth. Okay, decade. And so, is it like if someone is diagnosed with a tumor, what is the treatment and is it curable?
Yeah. So very nice question. So as I said, जैसे ही हमारे पास रेफर आता है पेशेंट ब्रेन ट्यूमर्स को, so first thing we do if there is no CT scan, we do the MRI. Now MRI sequence is also important. We need to have contrast, so we can know the degree of severity of the brain tumors. कितना ज़्यादा severe है. We also came to know now, thanks to neuroradiologist and advanced radiology of this era, now we have a sequences like functional MRI, we have sequences like a diffusion tensor imaging, DTI. we can have a MR spectroscopy, and that is the fantastic part of this kind of sequence because that not only can tell you that tumor is benign or malignant, that can also differentiate very, very specifically other infection, other demyelinating disease. So we can also, abscess like this kind of differential diagnosis. Now in this era, it is almost we are very after MRI, we are almost sure that okay, this is a benign tumor, this is a malignant tumor, and this kind of. Now suppose we came to know. Okay, MRI हो गया. Now the treatment of the brain tumor is the surgical excision.
Okay.
And in this till this era, there is a brain tumor which can only treated with medicine without confirmed diagnosis.
Okay.
So you have to go for brain tumor removal. Of course, there are the method of difference. Sometimes we need a complete excision, sometimes the near total excision. So if you ask me the treatment, there are two gross approach.
Okay.
One, we have the tumor and we decide the complete excision of the tumor either by craniotomy method in which we make complete open, we remove the bone flap. But now this is the era of minimalism, era of minimalism. It
Yes.
means it's the era of minimal invasive brain surgery, minimal invasive spine surgery. So yes, in neuroscience, in this last decade, it is tremendous advance changes happen. Like this era of keyhole brain surgery. Some tumors, like which is in the surface, we require only a burr of two of 1 rupee square size, 1.5 to 1.5 centimeter, 1.5 here. So this we do a single burr hole that is called keyhole. If this is enough, sometimes we go through eyebrow. Sometimes if there is a tumor which is in the like pistal adenoma, craniopharyngioma, skull-based meningiomas, only without incision we can go through the nose. It's called nasal transpyramidal. Complete we can excise them through endoscopy. There are tremendous advantages. Like one is cosmetic. So we nowadays we have stopped to remove the hair. We just prepare it and we just make the incision among the all the hairs. We make a space and the incision is because incision is 2 to 3 centimeter long.
Okay. Okay.
So one is cosmetic. Second, because incision is less, the chances of infection is very, very low. Recovery is fast, patient can be discharged on day 3, day 4. And with all the advanced technique which we are using nowadays, like how it could possible that we can remove a large tumor through keyhole only by precise diagnostic method intraoperatively. We use neuronavigation. So what is neuronavigation? We use it's a GPS kind of method. If we want to cross from here to suppose Ghatkopar, what we do? We put a Ghatkopar in our Google map and it shows the
Okay.
path. Similarly, all the patient of brain tumor, we do MRI scan neuronavigation protocol. We have a CD. Without the CD, we have a instruments for neuronavigation equipment. We put that data, and during surgery, it shows all the brain, and there is a tumor in the brain in three dimensions. So during surgery, we can exactly, precisely from the surface, we know the precise entry where the tumor is inside, in which area, what are the structures around it. Everything we can show in 3 dimension, colorful 3D.
Mhm.
And this is brain changer called neuronavigation. We have also used neuromonitoring surgery. Suppose there is a tumor called vestibular schwannoma. The patient comes with very loss. So there are so many critical structures around that, like facial nerve. So we nowadays using neuromonitoring, in which we monitor that nerves. So during surgery, if there is some chance of deficit कि हाँ अगर facial nerve damage हो रहा है, तो immediately that signals arise and we stop that. For example, tumors यहाँ पे motor area में critical area जहाँ पे patient को paralysis हो सकता है, speech area के पास है जहाँ पे patient को speech problem हो सकता है surgery में. We do the surgery awake remotely. The patient remain awake, and we go there because there's small incision.
Mhm.
During surgery, with the neuromonitoring, we can ask the patient to, you know, ask the name and address and different storytelling and hand movement. So our anesthetist can judge that yes, this is the critical point where witness can happen, we can stop that. So this is a newer kind of concept called awake craniotomy with keyhole surgeries.
Okay.
So here we are offering without deficit. There is a 100% guarantee of no deficits, no neurological problems after surgery.
Okay.
Despite of the brain tumor surgery is so very, very safe in this area. Now we
That's
have four endoscope, with larger screen, and its resolution is so much high that you can everybody can see in the operation theater. It shows very, very fine and difficult structures. We can go around, we can play very smoothly, and we can exercise complete tumor with post-operative fantastic functional outcome. So in this era, I suggest that the brain tumor surgery is very safe because of minimal invasive keyhole endoscopic brain surgery, fantastic intraoperative monitoring system, and rapid recovery and preoperative diagnostic system.
so.
So
That sounds very fascinating. Like going through the brain with a small hole. I would love to see that one day.
yeah,
And
yeah, you are invited in next operation theater.
thank you so much, sir. I would like to know, sir, after once you do the excision of the brain tumor, is there any role of chemotherapy or radiotherapy after the tumor has been removed?
Yeah. So we call it adjuvant treatment. So here we again we came here with the same concept. So benign tumor, like many tumors, colloid cyst, hysteroid, whatever the benign tumors, if you cure completely, if you are able to exercise successfully completely, the patient is cured. No need of chemo or radiotherapy.
Okay.
In case of glioma, if there is a low grade glioma, there are four stages of glioma: grade 1, 2, 3, 4. So grade 1 and 2 is low grade, 3 and 4 is high grade. So in grade 1 and 2, if you are able to exercise it completely, there is no requirement of chemo and radiotherapy. For grade 3 and 4, which is considered high grade, or as I said, GBM grade 4 glioblastoma multiforme, after safe removal, despite of you have removed completely or near total, you need to go for chemotherapy, which is for 1 month, which is very, very safe drugs. Not like the previous, because our neuro-oncology is now remain very, very high standard, and we have it's a basically amalgamation of complete brain tumor team. It also includes post-operative, neuro-oncologist and neuroradiologist, and as well as radiation therapist.
Okay.
So 4 to 6 week radiation is also required.
Okay.
Overall treatment is 4 to 6 weeks after surgery for high-grade tumors only, not in every patient.
Okay, so the prognosis is good for like of brain tumors.
Now, compared to previous era, nowadays the chemo and radiotherapy is also very, very more powerful and giving a good results. So for benign tumor, yes, absolutely good prognosis. For grade 4 tumor, still we are restricted to 2 to 2.5 years prognosis, not more than that, despite of all the treatments.
Okay,
But
okay,
it is for grade 4 only. That is why I told you should be once the moment you detected the brain tumors, you have to go for surgery, and early is best time.
exactly, sir. So coming to the end of the session, sir, I have a last question for you. What is the future aspect of brain tumor surgery? Could you please shed some light on it?
Yes. So I think as like other subspecialties like onco surgery field is also growing good. Uh, as far as brain tumor surgery is concerned, the next era is era of minimal invasive brain surgery, and after that there is the era of molecular biology, which may not require surgery. Nowadays, also gamma knife is very, very popular, in which so at present gamma knife is basically kind of laser. You can compare it with a laser in which there is no incision. You can put a gamma rays at the side of
Okay.
the tumor. If the tumor size is less than 3 centimeter, you use gamma knife. Sometime, if after near total removal of the tumor, if some residual is there, tumor is benign, yes, gamma knife can reduce the size of the tumor and prevent the further growth. So, I think molecular biology, genetic therapy, and of course, for surgery, minimal invasive brain surgery is the future of brain tumor surgery.
Okay. Thank you so much, sir, for giving us your valuable time. Is there anything that you would like to tell to the viewers?
Mm, I think the message is very, very clear. There were some myths that, oh, brain surgery, oh, spine surgery, we should not at all go for surgery. Rather, we should manage with those kind of symptoms and we should manage without surgery. We should find some cure by, various things. But this is the era of safe brain and spine surgery. It is now the surgeon is more focusing on your functional outcome जो है उससे better after surgery होना चाहिए. And we have a fantastic results, of course. All the neurosurgeons in India is now have a we can say maybe a number two or number three in neuroscience, and others, of course, in medical science. So no need to worry at all. Every brain tumor is not a cancer, is curable, and we are here to help you. That is definite. We are with you, and so no need to fear for that. So it's very safe.
Okay. Thank you so much, sir. And thank you, everyone. It was a very a learning experience for me as well. So, sir, next time, next surgery, I'm going to be there to see.
Definitely.
Okay. Thank you so much, sir.
Thank
Okay.
you.